do a cranial nerve exam today with Hope, one of our speech pathologists who works here. And I will say this, as a friendly reminder, we're in the outpatient setting, so when we're looking at functional control and we're doing a cranial nerve exam, we've probably already been and seen a functional doctor, we have a diagnosis, ideally. So here we're trying to pair out general functioning. We're also more than likely going to always order a swallow study if dysphagia is on the table. So here we go, we're gonna get started. So we'll always do a basic exam first. Will you give me a big smile? Great, and pucker like you're gonna blow a kiss. We're looking at orbicularis oris functioning here and general symmetry across sides. Will you puff your cheeks up like a chipmunk for me? Beautiful. Can you breathe through your nose while you do that? She's so functional, you guys. It's amazing. All right, I'm gonna go ahead and put a glove on here and I'm gonna have you do a couple things for me. Will you open your mouth as wide as you can for me, please? Thank you, and stick your tongue straight out. Beautiful. Typically, I will use my phone and I will take a look in there. We're generally looking for how the mucosa looks in there. We're also looking at tongue functioning. So do we see fasciculations, which someone once told me is likened to puppies moving under a blanket. We're gonna pay a lot of attention if we see some unusual tongue movements here. We're also gonna use the knowledge based on what we have for their diagnosis to help us maybe look at more things in detail. So I am gonna have you stick your tongue out at me. And now I am gonna push against you. Before I do that, I'm looking to see if there is any deviation there in the lingual musculature. If we see it's pulling to one side, typically that will mean that the opposite side is weak. We're gonna look into that. We know it's gonna affect intelligibility, our ability to tolerate boluses of different kinds, and use mastication skills. I guess you can stick your tongue in again. All right, I'm pushing against you. Push as hard as you can. Beautiful. Now I'm gonna have you stick it straight out, and I'm gonna push from the side. Don't let me push it off center. You're so strong. Thank you. Beautiful. I'm gonna have you do the same thing with your jaw. Go ahead and open wide. I'm gonna try to close it. Don't let me. Beautiful. Same thing here. I'm gonna push you off center. Don't let me move it. And this way. Thank you. Close your mouth. Again, it's pretty subjective when we're looking at functional strength. It's a rare day we're using something like a tongueometer for an eval for us, where we're going to get numerical data for how strong somebody's tongue is. We're using kind of general judgment here to say, oh, that's weak to one side, or oh, that feels pretty nice. Because again, we're going to use a modified barium swallow study to show us how the tongue is functioning during the swallow. I'm going to take my hand and I'm going to push against your forehead. Beautiful. Same thing from the side. Don't let me get you off center. Here we are looking at general functional neck strength. We're looking at postural stability. We know that the sternocleidomastoids in the front are playing a big role there. Can you clear your throat for me? Wonderful. And elicit a nice strong cough. Awesome. What a healthy cough. All right, will you turn side to side for me? We're looking for general range of motion, functional control. Same thing here. Can you now give me a big yes? Look to the floor and look up. Looks so good. Beautiful. Can you furrow your brow for me? Look as mad as you can. Now show me your best surprise face. Wonderful. With some of our Bell's palsy patients or again stroke patients, we may see a change in our ability to lift those eyelids, close or open our eyes. We know that the temporalis is here and here, big participation for mastication. We also know that the pterygoids, the mass eater, and the buccinator are going to play a role in mastication skills. So if we're seeing sided weakness or sided droop, we're keeping that in mind and using it to help us plan how we're going to exercise and improve general function and maybe what modalities we're going to use as part of our plan of care. All right, guys, am I missing anything? Okay, that's our general cranial nerve. Again, we're going to use objective swallowing evaluations to help us further see what's happening inside, but as a general rule of thumb, we need to see how everything's looking here and how everybody does during an eval. If you got questions, let us know.